The following presentation will explain what the child care facility will look like and training videos on how to deal with certain emergencies that may come up within the facility. The first thing is a little bit about our center. The mission statement is to provide the highest quality care and education of children that is Christ-centered and values all children as individuals. The vision of this facility is to provide care for all children by investing in their physical and spiritual lives. In order to do this, we will guide them through learning using basic principles as well as implementing the Word of God into every aspect of their learning. A little bit about the center. This is a Christ-centered facility that reaches children of all kinds to educate them in many different topics. A majority of the information learned will also be taught through a Christian aspect because that is an important thing to implement into the new generations. Our center is located in Cedarburg, Wisconsin, and we target age groups ranging from 6 months to 6 years. This is a little schedule on what a day in the life of the facility would look like. We would start off by greeting the students in the morning or in the afternoon, and then we'll go right into circle time. During this time, we'll explain what the day of the week is, we'll go over what the weather is for the day, and any other information that may be necessary to explain. We'll then have reading time, which is when a teacher would be able to read a story to the children, and then go right into snack time. They will then have an opportunity to read their own books and take a nap, and then after that time is over, they can have recess outside if the weather is nice. They'll then have exploring time, which is an opportunity for children to do household chores or activities such as doing dishes, playing in a pretend workshop, and other things like that. They then can go home. Now we're going to go over basic safety procedures. Two very common things that could happen in a child care facility is choking and getting a scrape or a cut. We're first going to go over choking and what to do when this instance could come up. I'm going to show you a video and it's going to explain exactly how to do it using the steps on the screen. I'm going to explain how to deal with a choking child and a choking infant. So to start off with a choking child, you're going to stand behind the child and lean slightly forward. Then you're going to put your arm around their waist and clench your fist. You're going to make sure that you use this knuckle of your thumb to help lunge the food forward, or whatever else they're choking on. You're going to place it between their belly button and the rib cage on the child. You're going to grab your other fist with your other hand, and you're going to pull your fist sharply backward, like towards you, and up. This will get into the rib cage. You're going to do this in 5 quick thrusts, and you're going to repeat it until the object is coughed up. For an infant, since they are much smaller, you're going to lay the infant across your forearm, face down. You're going to support them with your lap or your upper thigh. You're going to hold their chest with your hand, and you're going to hold their jaw with your fingers to support their head. Then with your heel of your first hand, you're going to give 5 quick blows between the shoulders of the infant, and you would do that until the item is coughed up. And if it doesn't work like that, you can always flip them over and do the same thing on their chest in between their rib cage. Thank you. I'm going to explain. Okay, now we're going to go over what to do when a child gets a scrape or a cut. I'm going to do the same thing as the past video, where I'm going to show you the video that will go with the exact words that are on the screen right now. Now I'm going to explain how to deal with a scrape or cut on a child. First step is you're going to wash your hands very well with soap and water, and then you're going to put on disposable gloves if you have them. You're going to clean the wound with water thoroughly to get any debris or anything out You're then going to cover the wound with gauze or cloth that is clean. You're going to apply pressure to stop the flow of blood. This will help clot the blood. And you're going to try to elevate the bleeding above the child's head if it's possible. Then most people will remove the cloth once it becomes soaked, but you're going to keep it on there so that the blood will continue to clot and not continue to bleed more and more. So you're just going to layer cloth on until it's not soaking through anymore. Then once the bleeding has stopped, put a clean bandage on the wound, and that will be it for a basic scrape or cut. If it's something more severe, you can bring the child into the doctor or call their parents to bring them into the doctor. Here are some other very common things that you may run into with your own childcare facility. The first is a sick child. This could be like a common cold. In order to help them with this cold, you can ease their discomfort with ibuprofen if the child is older than 6 months and if permission is given by the parents. You can use gentle suction to the nasal cavity to get rid of the congested nose. This is especially good for the younger children. And offer lots of liquids. If they're infants, you may want to use breast milk or formula, and if they're a little bit older, you can use water or diluted juice. Another thing you may run into is a child having a fever. The first thing you're going to do is check the fever to see if it is present. Fever is typically 100.4 degrees Fahrenheit. You're then going to make sure the child is dressed in light clothing. You're going to give them cool liquids to drink and keep the child calm. You're also going to call the doctor if a fever is higher than normal or if fever medication is necessary. Finally, we're going to talk about CPR. In order to do CPR effectively, you must be certified. There are many different places that you can become certified, but the American Red Cross is a great way to find trainings near you to become certified. Around the area of this childcare facility, you can get involved in trainings that are both online and in a classroom. A classroom option is located in Cedarburg, Wisconsin. Here are the steps to get certified. You're first going to determine what type of CPR certification you want. You're then going to find a class that fits that type of CPR certification. You're going to take the class and make sure you pass the certification test. You're then going to renew your certification if needed. Here are the steps that are involved with performing CPR. You're first going to check the scene for safety and use PPE. You're then going to check for responsiveness of the child or adult. If the person does not respond, call 911. Place the person on their back on a flat surface and give them 30 chest compressions. These compressions is where your hands are centered on their chest, your shoulders are directly over your hands, elbows locked. You're going to compress at least 2 inches into the body at a rate of 100 to 120 beats per minute. You're then going to allow the chest to return to normal position after every compression. After giving the compressions, you're going to give 2 breaths. You're going to open the airway to a past neutral position using the head tilt or chin lift technique. You're then going to ensure that each breath lasts about 1 second and makes the chest rise or allow air to exit before giving the next breath. You're going to continue giving sets of 30 compressions and 2 breaths and use an AED as soon as one is possible. Here's a video on how to do CPR on an infant or a child.
You arrive on the scene. Check the scene for safety. Check the child for consciousness. Gently tap the shoulder and shout,
"Are you okay? Are you okay?"
If no response, call 911 immediately.
You, call 911.
If the child is lying on their stomach, turn them over and to their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the child's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the child's chest and compress the chest 2 inches in depth 30 times.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 compressions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths, just enough to make their chest rise. Continue with 30 compressions and 2 breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue CPR until you see signs of life, another rescuer takes over, or help arrives.